Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. With me, as always, Adam Thacker, who's our Chief Operating Officer of Good Samaritan Hospital. We'll be giving you our weekly update on COVID-19, where we've been, where we are currently, and what we see happening over the course of the next few months or so. Most importantly, we continue to see good trends. If we look at total numbers, about 3,400 total cases. But the numbers we look at every week that really mean the most to us are those positivity rates. And the all positivity rate now down to about 6%, around 18% for the unique individuals, and really less than 100 active cases in the community. And again, these are some of the best numbers that we have seen. We didn't really see a big post-holiday spike like we were concerned about, which is great. People have been doing a good job over the course of the past few weeks or so as far as continuing with precautions, masking, and so forth, but really some encouraging news as far as that's concerned as we continue to progress.
Yeah, really positive, and hoping that we don't see a post Super Bowl
Yes.
Surge either. But so far, we really good numbers, good trends. I think one thing that's important to note is as we report these numbers, this is not just communities have decided to stop testing. We're still testing a high number of individuals, which is what drives those rates down. So as you have symptoms consistent with COVID, we still are encouraging convenient care, medical center, Vincennes, go and get tested, get assessed. And one primary reason for that is something that we've talked about a number of times is monoclonal antibody therapy. And with that, it starts with a test and identifying some of the high-risk individuals that may not be able to get vaccinated yet. But this is a bridge to keep them out of the hospital. Have seen huge success with that, 350 plus administrations of that therapy, and just a few 4 admissions in a population that otherwise would have been 70, 80 potential hospital admissions.
Yeah. And people are already asking, we're a couple months into our vaccination program, vaccinated almost 10,000 people, you told me this morning. I think that's absolutely phenomenal. And are we seeing the benefits of that already? And I think the answer to that is absolutely, because we've had a number of those people that have already been through their second dose. A couple weeks after that, they are considered fully vaccinated. And so we're seeing a decline in numbers, not just because we're lucky, not just because people are behaving themselves, but because we have a significant percentage of our population that's vaccinated.
Yeah, not only a percentage getting vaccinated, which is great. And 10,000, if you would have told me December 17th when we started vaccinating that we'd be sitting in early February at 10,000 already have been vaccinated in the community, I probably would not have taken that bet. But you add that into those that have had COVID, recovered, that natural immunity process, and you really start to get to some percentages that we're seeing impact hospitalizations and overall spread in the community. And certainly what's starting to flood the news now is variants of COVID. So the more vaccinations that we can get every day, and we're vaccinating about 350 a day here, and the health department out at the church behind the movie theater is doing their part and vaccinating, I think, 400 to 500 a week that they're able to get through there. And it certainly is supply based. We would take more vaccine and vaccinate more, and so would they. And the state is saying the same. So hopefully we see all the way up at a federal level that the number of vaccines getting pushed out can increase, because we can certainly increase capacity. But you start to add all of those numbers in, and we're really seeing that's having that impact on the community at this point, even starting with that first dose. And then definitely would put in my plug. It's not just get the first dose and then decide if we'll get the second dose. These 2 vaccines that are approved are 2-shot regimens. That's what the studies verify. That's what the safety efficacy panels, and certainly getting that second vaccine is what gets you to that 94, 95% immunity with the vaccine. And we need to make sure that we're getting dose 1 and then getting dose 2.
Yeah, absolutely. And, really looking across our state, the state is doing very well as far as that's concerned. Our county is doing amazingly well as far as that's concerned. But it's important to realize it's a 2-shot series. And so no different than what we saw, to kind of relate it to the shingles vaccine that came out about 10 years ago or so. wasn't really spectacular. We saw maybe a 50% risk reduction. With the newest one that came out about 3 years ago, 94% risk reduction, and that's a 2-shot booster series. So it's important to realize to apply this in the manner in which they were studied. And so all of us have gotten our first and then second follow-up doses. I have had a number of questions of people who have been concerned because perhaps they got sick with something else. Maybe they had a cold, maybe they had something else come up in the interim between the time that they were vaccinated with their first one and their second one. And the answer is, as long as you are not significantly ill, you should go ahead and proceed with that second dosage. We've even had a few people who have been exposed, so forth. Please proceed with your normal dosage. Now, we obviously don't want you to come in if you're sick as far as contaminating clinic and everybody else that's potentially involved, but we've made arrangements in some circumstances like that where we can go out and vaccinate individuals in their cars. We want you to make sure that you get that second vaccine so we can consider everybody to be fully vaccinated after that second one. Another thing that you just mentioned a bit ago, Adam, was the monoclonal antibody. And while we have seen a reduced number of those being given over the past couple weeks, it's really been because the number of illnesses have been down. But it's still important to realize that that is our bridge. That's our, if you haven't been fully vaccinated yet, if you can't get vaccinated yet, then if you get ill, that's where we want you to go first.
Yeah, that's been a great bridge to the vaccine program. And as you mentioned, we were giving anywhere from 10 to 12 a day and really going through our full allocation from the state resource to, as of last week, we were giving 1 to 3 a day. And so now we're looking at, how do we expand that, and we're getting those allocations from the state. But again, it starts with symptomatic individuals getting tested and then assessing risk. As we've said for a number of months, 70-80% of the population that get COVID are otherwise healthy, going to recover, pretty mild symptoms, would not be candidates for monoclonal antibody therapy, would not be at risk for hospitalization, needing additional treatment, are going to isolate at home, recover, and that's great. This is for that population that is at risk for hospitalization, at risk for progressing to severe illness that may require not only hospitalization intervention, but have longer term effects on some chronic diseases that they may have, diabetes, heart failure, anything along those lines. So certainly start to have symptoms, go get tested. It's a very smooth process now as far as getting tested, convenient care, medical center. For the most part, rapid tests are able to be performed, so 15 to 20 minutes and you have a result, and then that provider will help you with what the game plan is for next steps.
Yeah. And really the population we're seeing that be probably most applicable in now is what Adam was referring to, which is that population that has other risk factors that put them at greater risk for having a more severe disease course. So as we have seen a population open up with 80 and above, a high percentage of that population has come in to get vaccinated. 70 and above, same thing. As we're opening up to 65 and above, the population now that we're concerned about is that population that maybe is in their 30s, 40s, 50s that has chronic medical problems, chronic kidney disease, cardiovascular disease, diabetes, immune system problems, cancer treatment, those types of things. And perhaps those patients haven't had the option, or their group has not yet been opened up to be vaccinated yet. That population we absolutely want to be on their toes about. Symptomatic, get tested, be seen by a provider, and then potentially get in to get the antibody infusion right away, because we know that that population is at higher risk for being admitted and having more complications. So as we're moving forward, we've talked a little bit about the color change of the county. Can you speak a little bit to what we have seen in the past, and then really this yellow wave that has swept across Indiana, thankfully?
Yeah, as we've talked about the numbers improving, we have also seen the state, from a color coding standpoint, improve. Just a couple of weeks ago, I believe 3 weeks ago, 78 of 92 counties were red. So that is the worst of the colors as far as transmission for COVID. And then you fast forward to today, and just a few counties are red. I think it's 5-6 counties are red, and most have moved all the way out of orange into yellow as we're seeing these numbers decrease. Now, something that is very important to keep in mind, because as we follow that, everybody starts to look at, okay, things are relaxing, we're opening back up. We've been through this over the last 9 months, and as we start to do that, then we see surges, and then things start to get shut down again. So when you look at the color coding state map and you say, all right, we're yellow, that means this, this, and this, If you highlight over Knox County, the advisory will still say orange. And that is because we need at least 2 weeks, and depending on how things look, that may even be extended, but at least 2 weeks that you stay in the restrictions tied to the previous color. So there are limitations on gatherings, on social event gatherings, as well as extracurricular functions, event type of scenarios. And those are 25% is what orange is. And then anything that would exceed that has to be approved by the health department. So certainly seeing that that's all good news, but cautiously optimistic is how we have to continue to focus on this, because it just takes one event that leads to that super spreader type of event, and then we start to see a surge and then potential hospitalizations. And really nobody in our community wants to be tied to we were at an event and we weren't following masking and guidelines. And really the key element with going to events and trying to get back up and get back out and have some sense of normalcy is maintaining social distancing, maintaining public health measures, keeping our mask on. So even if you're going to events, don't leave those pieces out, that you're sitting with your household group, your family that you're in close contact with already, and keeping the mask on, except when eating and drinking, obviously. But even being cognizant of those interactions is really important.
Yeah, and we will continue as we go into the spring and even in the summer. We fully predict that will continue on until we can see some degree of consistency. As Adam said, when we look back, we have seen these trends, and unfortunately, it just takes just the beginning of a little bit of a spike, and then we're off to the races. So it's important to realize that those decisions will be made every few weeks, not just things are great today and let's open things back up, and then in a week the numbers are bad and we're going to shut things back down. So we all need to be patient about that. We all thankfully anticipate that as we roll into spring and we get into summer, things will continue to trend downward, things will continue to relax, because the number of people that are vaccinated will be increasing. Naturally, the spread of viral illnesses and so forth starts to diminish as we go into the spring and summer months. And so we fully anticipate that will continue to be the case. But please be patient with us. Work with your family, your friends about those events, and plan accordingly. Really, we've transitioned through Super Bowl weekend now, and the next thing, of course, will be spring break that will be coming up. So as you're making your plans for that, it's important to take into account, if you're going to go do something with your family, if you're going to travel somewhere, make some plans to be socially distanced, make some plans to be isolated within your own group. That helps to keep that lower risk, and then I think we'll continue to progress and do well over the course of the next few months. Any other major issues before we go to the phones?
I think the only other thing would address this morning is that last week on the governor's update, there was communication regarding school proposed changes from a state level, or changes that could be implemented. And we were part of a conversation with our school superintendents, Dr. Stewart as the health department, and really feel like the process that our community has put into place for our schools related to quarantine, related to the testing elements from a school standpoint are working for us. It's easy when you're in this community to look at, we'd like to see it relax more and more and more. But keep in mind that those changes from the state were really rolled out because by and large, a lot of our state is not back in-person learning. Right. So Indianapolis area, I believe, public schools have not went back to school at any point. So they're looking at ways to help facilitate that, get back to in-person learning. We've been fortunate to be able to do that. And so, what came out of that discussion is that all of the schools, Good Samaritan as the healthcare provider, the health department agree that what we have been doing is working, and that the impact on our schools has been minimal. Now, I say that, but I know if you're a parent watching and you have a student that's been quarantined multiple times, you don't see that as minimal, and I truly do understand that with school-age children myself. But we're making that decision as a system that works, and the best decision for Knox County and Knox County schools, and that was done in collaboration between school, Good Samaritan, health department.
There have been a whole host of suggestions by the CDC as far as quarantine guidelines and so forth. And we really still encourage people to follow those original guidelines, which have been a 14-day quarantine after exposure, 10-day with illness. The adaptations to that, some of them we certainly don't necessarily align with or agree with. However, we will continue to look at that over the course of the next few months or so. And as we march through week by week and look at those, we may potentially adapt or adopt some of those. But for now, we want people to stick with those original quarantine guidelines because the likelihood of having spread of the virus with those is extremely minimal when we look at the percentages of infectivity.
Yeah, I think it's really easy to read that and see, oh, on day 8 I get a test, and now I have an 8-day quarantine instead of 14. But that header at the top, we often skip over that says 14 days is a 99.9% effective, and that is the recommended best practice. So don't just skip to the alternate because it's out of convenience, because doing things out of convenience is what gets us into a situation where we end up having to shut down events.
Yep. As Adam said, we're kind of a unique microcosm here in how well our schools have done. Students have done fantastic. Teachers, administrators have done wonderfully and kept our students in person for learning, which we are all very thankful for. And we don't want to mess that up. And so pretty much across the board when we had our meeting this last week, it was, hey, things are going well. Let's not change those guidelines for right now. Any other things before we go to the phones?
Let's see what questions we have.
All right. The first one, I think by we, she means Knox County as a whole, but explain why we were at 39, now it shows 80 deaths.
So part of that is a recording issue, and it's not been a sudden jump. We're in communication, Dr. Mahan, who handles our hospice program and so forth, and the way that reporting has gone. This has been something that has been an ongoing issue in terms of how those are reported, recorded, and then put out through the system. So there has not been a rapid jump in that number, and certainly we have seen that number sitting in the high 30s for weeks and weeks and weeks, and then suddenly jumped up to 80. That has not been indicative of what the course has been. It's been a recording issue with the way the system works.
Yeah, I think we had said at one point on a previous Facebook that we expected that number was about double. Just that lag in reporting. The state had even said that statewide numbers at one point was about double, and I think that they're putting some resources towards catching that up.
Right.
Okay. After the shot of Moderna, how many days until the second shot?
So 28 days is the recommended for Moderna. Shot 1, and then 28 days later is shot 2. There is a range from that 28th day. CDC says up to 42 days that second shot can be administered to really get that full immunity. But all of our scheduling or the health department scheduling for that focuses on trying to get to that 28th day, and then they look at the 29th day, the 30th, but really trying to stay within a 4-day window of 28. Here at Good Samaritan, we have the Pfizer product, and it's 21 days, and we follow the same methodology. So we start at, can we get that second shot on day 21? If not, we go out up to 4 days, and then we will expand beyond that if there are rare circumstances. But really, it's that 21 days for Pfizer, 28 days for Moderna.
Okay. How soon after having COVID should you get the vaccine?
So I think that's kind of a two-part question. What you've heard us say in the past is if you've had recent illness, we presume that you've formed antibodies to that, and if you don't feel strongly about getting the vaccine right afterwards, we would encourage people to wait somewhere around 90 days to get vaccinated. You will hear that on the news, you'll see that on the internet, so forth. Sometimes people confuse that with I shouldn't get the vaccine before 90 days, and that's certainly not the case. We want people, if they feel compelled to go ahead and get the vaccine, to get it when they're fully recovered. And so for some people, that recovery period may be just a few days. For some people, it may be a couple of weeks. We've had a number of patients that were signed up, got the illness, were recovered, and then went ahead and received their vaccine as they would have been scheduled already. The main thing is we just don't want you to be ill to the point where you're not feeling well enough to sustain yourself. We also don't want you to come in while you are ill to get your vaccine. As Adam had said, there have been a few circumstances where people had become ill in between vaccine number 1 and 2, and we've made accommodations through our system to basically make sure they got their second vaccine on time or as best we could on time. But really the 90-day thing that you hear about is more about another person having the opportunity to get that vaccine that wouldn't have their own inherent immunity that they would have formed to the illness. So there is nothing out there that says you cannot get the vaccine before 90 days. It's more about encouraging somebody else that opportunity to receive it.
And if you've gotten shot one, there are going to be things that come up, whether it is COVID and acute illness or other acute illnesses, or even something not an acute illness, but maybe a surgery or something that comes up. If you have questions about that, because the timing of it, it can be difficult to understand exactly medically what should you do, contact your primary care provider. If you don't have a primary care provider, contact our COVID triage line that is staffed with nursing staff that can help to navigate, here's what you should do, and they'll give you that advice to help schedule that second dose at the right time for you.
If someone has been fully vaccinated and has symptoms after the 2 weeks from the final vaccine, should testing occur?
Sure. So the biggest question that people get a little bit confused about is, will the vaccination corrupt the testing process? And the answer is no. If you think you are coming down with the illness, certainly we want you to see somebody and get tested. So the testing is just as effective as far as that's concerned. The reason people get a little confused is when we speak about antibody screening or antibody testing to confirm immunity, totally separate issue, not reflective of the acuteness of the illness as it comes on. So that being said, this time of year we still see influenza, viral upper respiratory infections, a whole host of things. Those have been considerably less this season and this year than we have ever seen in the past, as long as I have been a provider, as a result of the masking and precautions that we have been doing. But it's important to realize that all of those similar type of things can still come up. So if you are ill, please see a provider, get evaluated. I saw somebody just last week that had appendicitis, and these things come on with febrile illness and people feel sick. So please still realize that all the normal things are happening in life despite what's happening with COVID-19. So if you're feeling ill, get evaluated. We can help you kind of navigate the system of when you've been vaccinated and if we need to do additional testing at that point in time.
And I have fielded some questions from those post-second shot that have gotten tested and have tested positive. Mm-hmm. And I think it's important to note that the vaccine does not prevent the virus from entering the body, and you can test positive. When we talk about 95% efficacy, that is from the virus creating a clinical illness, so being mild to moderately sick, and almost 100% effective at severe illness requiring being in the hospital. But it does not prevent the virus from being detectable in the body. So if you test positive after being vaccinated, that does not mean the vaccine didn't work. If you have very mild symptoms, it may mean you would have had moderate to severe symptoms. Thus, the vaccine is doing its job, just it is not preventing a test from being positive if you've come in contact with the virus itself.
And interestingly, despite the fact that in the studies they reported a higher side effect rate after the second vaccine dosage, I personally and many of my colleagues, we have really not seen much of that. I don't know if that has been reported much through the clinic at all, but
so through the clinic, we've seen some individuals that have had side effects. Not really a big distinct difference between dose 1 or dose 2. Dose 2, we've had some that have had some more tiredness, just in general malaise for about 24 hours after the shot, but nothing of a serious nature. And thankfully, I'm going to go over 10,000 vaccines today, and we have not had anyone that has had severe reaction, as kind of was put out there early on as anaphylactic type of reactions that require kind of immediate intervention. We have not seen that. We've seen some individuals that have had hives, a little bit of fever, muscle pain, typical stuff that is actually the numbers have been lower than other vaccines. Right. Just the highlight on this has been pretty dramatic. So we have an observation period where 15 to 30 minutes after your vaccine, you wait, you're observed, and then during that time we also hand out information for what's called VSafe, which is the CDC's program for reporting any side effects that you have due to the vaccine. They aggregate all that data, and again, thus far, the millions and millions of doses have been given, so there are going to be some events that you hear about, but they are relatively low and even lower than other vaccines that have been in place for years and years.
Yeah. And every day we field questions personally about, are we going to get the vaccine? We have gotten the vaccine. Right. Are our families going to get the vaccine? Yes, our families are getting the vaccine. I have a number of friends overseas, one in Australia that contacted me yesterday that said the vaccine is going to come to their country within the next month. So So just realize that we're very fortunate where we are, that vaccine distribution has gone so well, vaccine administration has gone so well, and we're progressing on with things because people in many other parts of the world, many other countries, haven't even had the opportunity to get the vaccine yet.
Okay, if a child has a reactive antibody test but was never tested for COVID when symptomatic because the parent was already a confirmed positive, should the child be able to return to school with their doctors now instead of having to quarantine again for 14 days since the child does have antibodies?
So having had antibodies confirms that there's immunity to that. The unfortunate thing is we don't necessarily know in terms of ability to pass on that virus what that's going to be. We know that individual is protected. We know the likelihood of them getting that illness again is extremely low, although there are some reported cases. They are few and far between people who had the illness, recovered, and got the illness again. But it's important to realize that the quarantine guidelines and so forth, the only thing that has really changed is if you have been vaccinated, if you are fully vaccinated, and then you have an exposure, how your quarantine would be treated.
Right. And I think there's some missing elements to be able to truly make that decision that are going to require, working with the school, and they will probably talk to Dr. Stewart from a health department standpoint. So what the schools have followed is a pretty strict rule of if somebody tested positive from a student standpoint, that then they have that kind of 90-day grace period that you expect they've developed antibodies and would not have to quarantine.
Yep.
But in this case, you're drawing the antibodies immediately and you don't know where that 90-day window is. So as you mentioned, what's the protectivity and what does that look like? And then from a child standpoint, if they have any symptoms, they certainly can't return to school. So they would have to be asymptomatic. So that factors into it as well. So there's a lot of pieces to that would have to be evaluated really from a school standpoint to just discern, are they following their process and where does that fit in?
Yep.
That's it.
All right.
Okay.
Any other things?
No.
Well, thank you all very much for joining us. We'll be with you again in a week, and please follow your precautions. And as far as planning is concerned, please look at the times coming up as far as next big events, including Easter, including spring break, and plan accordingly for that. We're not done yet, but we're progressing and things are going well. So please continue to wear your masks, social distance, good hand hygiene, and we'll see you in a week.